My name is Laura Wheatholder. I'm a registered nurse and I'm the Community Outreach Coordinator for Blessing Health System. I originally enrolled at Blessing-Rieman College of Nursing, now Blessing-Rieman College of Nursing and Health Sciences, about 6 years ago. I joined through the Advanced Placement Program, which is a program offered for students who already have a bachelor's degree. My previous degree was in communications. I had a Bachelor of Arts, and I looked to BRCN because I really wanted a career change and something that would offer me longevity and a lot of opportunities. Immediately out of nursing school, when I finished with my BSN, I had a job waiting for me at Blessing, a job waiting for me that I wanted. I wanted to work in the emergency department, and the education and experience I gained through Blessing-Rieman helped me get that job right away. So that was a really big advantage because Blessing-Rieman is affiliated with Blessing Health System. There is that relationship there. You know those people at the hospital. You get to learn in that environment and train with those nurses and work at the bedside. So it really is an advantage for anybody who is looking for placement right out of nursing school. I worked for a number of years in the emergency department following my graduation, and then eventually transferred into the outpatient world. I worked in our outpatient care coordination department, where I helped our patients who are not in the hospital connect with the resources and services that they needed. And that was really fulfilling because as an emergency department nurse, so often you see people who are coming back in because they don't have resources. And as an outpatient care coordinator, I was able to help people get those resources so they weren't readmitted to the hospital. Eventually, I was presented with the opportunity to take on our community outreach coordinator position, and now I help the health system with their community engagement initiative. So health fairs, health screenings, really making sure people are aware of and have access to all the services that the health system offers. About a year and a half ago, I started thinking about going back to school to get my master's degree. And the first place I thought of was Blessing-Rieman, just because I know the program, I know the instructors, I know the faculty here, and I know just how hard they work to make it possible. They're never going to leave you hanging or with a question, or if you have a life circumstance come up, they will work with you. The biggest reason, though, for me joining the master's program through Blessing-Rieman is it's all online. I work full-time. We have a very busy family. I have 2 young kids. My husband and I are constantly on the run, keeping them to and from their activities. And so the thought of joining a master's program was really daunting, and it was something I kind of put off for a long time, especially knowing that it is a full-time program. But the more I thought about it and the more I talked with staff and faculty at Blessing-Rieman, the more I thought, I really can do this. And I knew that they were going to have my back through the whole entire program. So I am now on track to graduate in May with my master's degree. The program being online is such an advantage because while you don't necessarily work at your own pace, you have the freedom to do it when it works for you. I don't have to be on the computer at 8 a.m. in the morning. If it's 8 o'clock at night after my kids go to bed, that's when I can get my schoolwork done. There are deadlines and things like that, but the teachers and instructors are always there to help you, to answer your questions. They're accessible, and it's just, they make it so that it's easy to do and feasible. You're not on your own, even though you are kind of on your own working. You're never alone. They're always there to offer support and answer your questions and give that guidance. And for me, that's really been my experience with Blessing-Rieman. Through my BSN and my MSN, they offer the support, the guidance, and then you're connected, like I said, to the health system. So when the time comes, you have that connection there, and you can look for employment opportunities or advancement opportunities. And it's just a great all-around program.